Hello, everyone. This is Shad Reyes for another episode of SAMS Voices. This is episode come to you for first Saturday every month, highlighting and featuring a SAMS member who have achieved and has been accomplished during the journey of their career, either at the personal level, but more importantly, at the SAMS level as well. Today, I'm really privileged to be with my close friend, Dr. Bakri Kaakeh. He is cardiothoracic surgeon at Covenant Healthcare, clinical assistant professor at Central Michigan University, and member of Royal College of Surgeons in Edinburgh, and co-chair of cardiac surgery program of SAMS, and board member of Syrian American Council. And he is also a private pilot. We'll talk about it in a minute. Bakri, thank you so much for being with us.
Thank you, Shadi. It's my honor to join you today on this podcast.
Yeah. So, Bakri, I mean, you are one of the very rare traits of being a Syrian physician, graduated from University of Aleppo, and being a greatly accomplished CV surgeon in the United States. A lot of people are very kind of not familiar with the specialty, and also they are not familiar how to get to that competitive field. Because I think, to my knowledge, there is only 4 or 5 CV surgeons are graduate from Syria in our current generation. So can you walk us through your journey since you graduated from hometown till now?
Thank you, Shadi. Yes, so I just wanted to kind of pretext this with the small detail that I actually went into medical school kind of pursuing a dream in CT surgery. I was inspired when I was a kid by a great surgeon of our times, Sir Magdapu, an Egyptian surgeon who practiced most of his career in the UK. I remember he was hosted by Syrian TV. I must have been 9 or 10 years old. And, you know, they called him the surgeon with the golden fingers, not because he was rich. I don't think he's rich. He's a very charitable man. But he did so much for the specialty of cardiac surgery back then, and continues with his charity organizations, that even as a 10 years old, I got inspired by him. And, you know, I was telling myself back then that I want to be this man. And subhanallah, you know, I worked towards that dream. So, you know, went through high school, went into medical school, knowing that this is the specialty that I want to go into. My first kind of contact, my first experience with CT surgery, with cardiothoracic surgery, was as a medical student. I was a fourth-year medical student. I had, alhamdulillah, the opportunity to go to the UK and do an elective there with the Egyptian surgeon in Scotland, in Aberdeen, Dr. Shafi. He was the head of CT surgery in that place, in Aberdeen Royal Infirmary. And that kind of, you know, set my mind on that goal, on that target, that, you know, this is the specialty that I want to do. So finished medical school and did my, and back then, you know, I asked the friends, I asked the people around me, those who are interested in moving abroad and specializing abroad, you know, do I go to the US? Do I go to the UK? Knowing that this is, you know, I have a target, I have a goal, I want to achieve it. How can I achieve it? The advice that I received back then is that the US is almost impossible. You know, we're talking about early 2000 here. That the US is almost impossible for me to go into that track. You know, I have to match into general surgery, which is, you know, it was a rare event for a Syrian graduate. And then, you know, I have to match in CT surgery after finishing general surgery, which is another bottleneck that I had to face. I asked, you know, I already had some experience with the UK system. I did some electives, spent a few months in the UK during my medical school. So I ended up deciding on going to the UK, did the UK licensing exams, moved there. And I tell you, the path there wasn't smooth. It wasn't straightforward. You know, the system there was kind of undergoing, you know, reconstruction. You know, they were changing from the older system where you go house officer, senior house officer, registrar, to entirely new system that's compatible with the EU rules and stuff like that. So it was a very bumpy ride for me when I moved to the UK. Nevertheless, I have a goal. I had a goal. I had my eyes on my goal, and I kept, fighting for it. Did 7 years, and over 7 years. I was well into my CT surgery training. I got my membership in the Royal College of Surgeons in Edinburgh. I was a registrar. And then, subhanAllah, I was sitting, kind of doing some studying on the internet. For those who are interested in CT surgery, there's a website that are very famous. People go there to, watch video for surgeries and stuff like that, called CTSNet, sponsored by the Society of Thoracic Surgeons here in the US. And they have a
CT
career
Sniff?
section,
CT, what is that
CT,
website called?
ctsnet.org.
Okay. Mhm.
So that was the website. I was, just, looking at some surgeries, watching some videos for surgeries. They had, column next to just like many websites, for advertisement. The
Mhm.
advertisement at that point was for careers, in the career section. So, hospital in Massachusetts will advertise for a job here, Michigan, this state, that state. And then, kind of one post attracted my eyes. It was about unfilled fellowship in Oregon. Honestly, I've never heard of Oregon at that point. Like the state of Oregon, I've never heard of it. I didn't know that there is a state called Oregon. But it says,
We
there's
know
a.
Chicago, Houston,
I
New
know.
York.
I never heard of. I didn't know on the map. I had to go on Google and see, like, find where is Oregon in the U.S. But so the post said, there's unfilled accredited ACGME accredited 2 years fellowship. It sounded like the fellow who was matched to that fellowship kind of pulled out last minute. So I clicked on it. It says, submit your CV if you're interested. I clicked on interested. So just to give you a little background here. So when I moved to the UK, my plan was to finish CT surgery, do
Go ahead.
some taking a lot of time, but I think it's important.
No, no,
Uh,
so yeah, and go back Syria maybe. That's your
right,
plan.
was my plan. Finish in the UK, do a little bit of fellowship or some work experience in the US, and then go back to Syria. That was my plan. So right when I first moved to the UK, I took my USMLE exams.
Okay.
So I moved to the UK in 2005. In 2006, I had my ACFMG. I took all the exams, and I had it. But I never did anything with it. It was just, I had it. I knew that at some point I want to
It
go
was
and
a
do something.
trend. Everybody doing it, I will do it.
So I clicked, I submitted my CV. Few days later, I get an email, you submitted your CV. We're interested to kind of talk to you. So I get a call from the fellowship coordinator. She goes through my CV, and she asked me, "Do you have A7G? This, that?" I said yes. She said, "Well, we would like to interview you for the position."
And
So
what
I
is the
get
position again,
uh,
Bakri? What's the position?
it's a 2 year ACGME accredited fellowship
For
in
what?
C
CV surgery?
yes,
Seriously, okay.
in Oregon. Uh, which is, by the way, it's very hard fellowship to get.
Competitive. I know,
Uh,
yeah.
But as I said, that guy, whoever matched in that position, decided not to follow on it
Oh,
last minute. So they only had, about, I think that all of this happened in April, and the fellowship starts, end of June
mhm.
or beginning of July. So I get a call from the chair of the department. He asked me this and that, and he said, "Okay, we're gonna set up another interview with the rest of the surgeons in the place, and we're gonna talk to get your reference." So honestly, at that point, I really thought that this is far-fetched. I didn't even tell my wife about all of this. I didn't tell her that, for a fellowship in
Great.
the US. So, a week later, I get another call, and another couple of surgeons from that place. They tell me, they go through the interview process, and I hear from my surgeon in the UK that I got a call from a surgeon in the US, and they're asking about you. I said, well, this is the, I applied for this position, and this is, what they're calling you about. And then, within few days, they called me and say, we'd like to offer you the position. I was really shocked. Just imagine, because it wasn't even in my plan at that point to actually move to the US. So I went to my wife and I said, how do you feel about going for a couple of years to the US? And she's like, for what? I said, well, this is the story. She said, okay, if you think this is gonna, help your career, advance your career, let's do it. We had 3 years old kid at that point. So, I applied for it was a visa, I got a visa, and within a few weeks, I started my fellowship in the US, in Oregon Health and Science University, 2 years fellowship. Around that time, the Syrian revolution started, right around the time that I started that fellowship. Uh, so, the revolution started in March. I was there in July. So even when I got there, to be honest with you, that was the last time I didn't go back to Syria. My family did, my wife and my kids did. And at that time, Aleppo wasn't still involved. There wasn't a lot of fighting in Aleppo. So we went and I started my fellowship. Soon after that, of course, the situation in Syria got really bad. And I started realizing that probably my dream is not going to be fulfilled. That is going back to Syria and practice in Syria.
Mhm.
So the first year of fellowship went by. Alhamdulillah Rabbil Alameen. So because of my experience in the UK in CT surgery, I was well ahead compared to other fellows in there. So, so Alhamdulillah, I had a good reputation among the surgeons there. They liked me, I liked them. It's hard work, a fellowship like this, you're in the hospital 16, 17 hours, and you're on call every other night, and it's hard work, but alhamdulillah, I mean, you learn a lot through it. Um,
So your plan was to do these 2 years and then go back to Syria or to go UK?
Originally, the plan when I went for the fellowship, because I haven't finished my fellowship exams in the UK,
Oh,
so I
okay.
would to finish these 2 years, go back to the UK,
Mhm.
take my fellowship exams, which is equivalent to the board, to the
Okay.
US,
Mhm.
and then go back to Syria. That was my plan. So when I got to that point after the first year of fellowship, the program director sat down with me and he said, Bakri, what do you want to do? I said, well, originally this is, when I came to you, that was my plan, do these 2 years, go back to the UK, finish my training there and head back home. But it doesn't look like this is what's going to happen, with the war in Syria and everything. He said, well, you need to decide. I said, I think I want to stay here in the US. He told me, actually, he gave me an advice which I value and till this point, and I'll value for the rest of my life. He said, Bakri, if you want to stay in the US, you need to get your board certification. That will give you freedom of looking for the job that you want, and it will give you the guarantee for a long career in the US. He said we would be more than happy to offer you a job here in this place without a board certification. But the problem is that I like you, the other surgeons like you, but we're not going to be here forever. What if we go and someone else comes and you don't get along
Yeah.
with
You're limiting
along
your options.
and
You're
you
limiting
don't
your options.
have a board certification, then
Yeah.
you will be at mercy. I said yes, that's fine. Of course, that means I have to go back and redo the general surgery training in the US because back then the only way you can get board certified in CT surgery was to finish your general surgery training and then do fellowship. So I got in contact with the board of the American Board of Thoracic Surgery and General Surgery, and we kind of came up with a plan. They said you have to go back, get your you have to be eligible in general surgery for the board. Then you will be able to sit for the CT surgery exam. So I went. Dr. John Hunter was the chair of a very famous general surgeon. in the US. I sat down with him. I told him, this is my situation. He said, don't worry. Well, you're a good surgeon. We're going to offer you the general surgery residency. And they did. So I stayed in the same place. I did 4 years instead of 5 years. They gave me 1 year exception. And then by the end of
But
it, I was,
that means you have to go with junior people who just match in general surgery,
yes.
and you
So,
are a CT surgeon already.
right, yes. So
So
I was,
how's your feeling? How did you accommodate and change your kind of attitude?
I was a fellow,
Yeah,
a graduating fellow.
yeah.
As a graduating fellow, we would usually get the fourth year general
Let's go with
surgery
you.
to rotate with us, CT surgery. So I would have to teach them how to open a chest, how to put a chest tube, and things like that. Uh, and these people, so the following year they were chiefs in general surgery, and
And
I
you're
was.
the intern. That's what I'm saying. It's a very awkward.
I know.
Uh,
But I honestly, these people treated me so well. They were
yeah.
very accommodating and very respectful of.
But that speaks to you, Bakri. Like you are like I'm not talking about age, like in terms of your age at that point, but I'm talking about like seniority in terms of and seasoning. Like it's take a lot to kind of downgrade your kind of level of training. So you be the intern taking the pages on the first year. And I know a surgery internship is hard. Like it's you'll be like doing all the scut work.
Generally speaking, Shadi, this is my approach to life. Stay humble, stay open to learn. You're not any better than anyone else around you, and nobody is better than you.
Perfect.
I
Yes.
had a goal, and I wanted to work for my goal. I was a very goal-oriented guy, and alhamdulillah, I kind of proud myself that I continue to be goal-oriented, and I think this is a secret of success in life.
I
Um,
and I think speaks a lot, as I said, to your personality. And but this is the best advice, really, to stay humble and learn, and the doors will open for you. Because if you have been more arrogant, put it this way, or kind of not treating the fourth year resident the right way, maybe they could have gave a bad kind of impression about you. But alhamdulillah,
Absolutely.
mashallah, yani your attitude and your approach to your pathway in career has been phenomenal. So
I
speaking
know.
of goal-oriented,
Yes.
so you are the one who started involved in SAMS. We're going to talk about it in a second, and launched the CV program in Northwest Syria. So tell us, how did you start with SAMS?
Right. So, Sam's, since I was a fellow, my exposure and my involvement with Sam's, it was limited to, going to the conferences. And, fellows here, they have limited resources and limited time. You can't really invest a lot of time and resources as a fellow, especially if you have a family with kids and stuff. But I was I admired the work of SAMS from very early on during the revolution. That what they did to Syria, with all the field hospital, all the sacrifices, all the support that they provided, their messaging, really kind of hit home for me. That and spoke volume about the kind of the nature of the Syrian doctors here in the US and what they did to help their people in Syria. So that's how my exposure during fellowship. Alhamdulillah, after I finished and I started my job, I had more time, more resources to invest in SAMS, and I started doing lectures and being more involved. And after the earthquake in 2022, I went on my first mission inside Syria. So that was to the northwest of Syria, to Idlib. And that was, kind of, I went to provide help mainly for the earthquake victims on the thoracic side. And I wanted to assess the situation of cardiac. And, when I got there, it was a great experience. One, when I went to Idlib in 2022, I wasn't expected, I didn't expect what I saw. I was really impressed. I was expecting to see, an area ravaged by war. They just had a huge natural disaster, the earthquake.
Mm.
I expected to see people in tents. people, poor, wounded, etc. That's not what I found. I found really well structured city undergoing a great infrastructure project, electricity 24 hours, roads, organization, security. I felt safe there. But when it comes to cardiac surgery, they were really, really struggling. There
Mm.
was, so, you're talking about an area that had 5 million people, and they
Wow.
only had one functioning cardiac surgeon operating in one functioning unit
Wow.
supported by Islamic Relief. They were, Islamic Relief at that point were providing funding to do about anywhere between 2 to 4 cases a week. I
And
looked
this valves and cabbage or
for
everything?
genital, no, no, this is adult and congenital
Oh my God.
in people. I mean, this is, if you compare it to other places, the WHO talks about the need of at least one cardiac surgeon per million capita. So you're talking about one surgeon for 5 million, one unit. The Islamic Relief did their best to fund it, but funding is limited. So I looked at their waiting list, and that was in 2022, and I saw that their waiting list goes into 2025 and 2026. They had 3 to 4 years waiting list. So I realized that we need to help as SAMS. So I went back to SAMS leadership, and I told them that the situation is really dire
Mm.
in Idlib. We need to help with the CT surgery. So, we started, from the beginning, trying to kind of build a picture of what a cardiac surgery sponsored by SAMS would look like. Alhamdulillah, I was joined by another Syrian American surgeon, Hazem Al-Wa'ar, and, kind of together, and Ahmed Taraji. Together, we started thinking, okay, we need to work on establishing a SAMS-sponsored cardiac surgery unit. And alhamdulillah, within 3 years, we now, very proud of opening a heart center, which as Zira'a Hospital in Idlib, kind of heart disease-centered hospital, which is very unique, probably not only in the northwest of Syria, but in the entire Syria. We provide comprehensive cardiac case, cardiology, intervention cardiology, EP, and cardiac surgery, alhamdulillah, Rabbil Alameen.
And Bakri, just to one comment about CV surgery. CV surgery is the surgeon definitely very important, but you need to train the techs, the nurses, the unit, the care after surgery. This is very important, and this is, I think, part of the build-up.
And again, that was our approach from the get-go, that this is not just about providing actual, surgeries, but actually building a team, a local team that
Yeah,
can work, around the year, not just when we go on missions. And alhamdulillah, Rabbil Alameen, we sponsored perfusionists, anesthesia technicians, and even surgeons. So last year we started a cardiac surgery fellowship program. We now
wow.
have, alhamdulillah, 3 fellows that are in training, and they are really great fellows, and I see them as inshallah a great asset for the region in the
Do you
future.
have a rough estimate how many surgery has been done since the program started?
So, SAMS itself, we sponsored in the initial phase, and that's last year. We sponsored as just SAMS initially 60 surgeries,
Wow.
and during missions between last year and this year, we did another 40 surgeries, and since the launch of Al Zira'a program, so we're talking about 120 cases so far. And this is a
It's
project
big.
that the idea started only 3 years ago,
Yeah.
and you can the project. So alhamdulillah, Rabbil Alameen, I think we are setting the foundation for a great success story in CT surgery in that region, inshallah
And
ta'ala.
just to give the audience an idea, is like there is some hospital in the United States, they barely do 50 cases a year. So
Here,
for some, right? I mean, correct if I'm wrong. So for a program that have nothing, no resources, just maybe some primary services to build and to do 60 plus cases, that's a big achievement. Yeah, that's a great, great number.
let them work ethics and dedication the staff kind of provide us when we go there. I mean, when we go there, we go as two surgeons. We have two rooms, and these people are working with us from 7 a.m. till 11 p.m.
Yeah,
They no complain. We don't hear a word from them. They're working very hard, and what you feel is that they're not. This is not a job for them. This is duty. That they're doing
right.
their duty to people, and this is what inspires you when you go there.
Yeah. And this is going to be a grassroots for a program. As you mentioned, this is like Sadaqa Jariyah, right? You train somebody and then eventually they're going to carry the torch. And then this generation of fellows are going to train another generation of fellow and another generation. So this continue. MashaAllah. Thank you so much, Bakri, for its hard work. So going from education to missions, now get into some politics. So you're involved also in Syrian American coalition that has a major impact, and we witness on social media and other platforms their impact. So tell us about the coalition itself and your involvement and what they have, how it contribute to the finish of the regime.
Right. So I'm a board member on the Syrian American Council. Syrian American Council is a political advocacy organization that was established in the early 2000s. So it actually started before the revolution. The idea behind it was the people who started the organization, they wanted to open channels between the politicians here in the US and the Syria. You remember even in 2004, 2005, when the organization was established, Syria was still, a country that's on the terror supporting, countries. We had a lot of sanctions even back then. Relationship between Syria and the U.S. weren't great. So that was the idea behind the kind of the concept behind that organization. But when the revolution started, that organization worked really hard on political advocacy, kind of trying to support the people against a brutal regime that was, massacring its people.
Final part is a fun part, is to know more about you, Bakri. And I mean, I have the privilege, and thank you so much to being in your house multiple times. But you are the man of very rare traits, very rare hobbies. MashaAllah, you have a very adventurous career, but also I think you have a very adventurous life. So tell us about what do you do at your free time?
Well, first of all, I don't have free time.
If you have free time, if you have free time, I know you're busy already with all these activities, mashallah.
Going on, there's not much free time. So subhanallah, I grew up around horses back home in Syria. This is the love of my kind of the passion of my childhood. And every time through my journey, in the UK and the US, every time I had the opportunity to go and be around the horse, I did it. In the UK, when I had the chance, I would go and to the riding schools and take some lessons to learn the way they do it. And then when I had alhamdulillah the opportunity, I got back into it. I have some horses that I keep on my, around my house. For me, this is a passion. This is my childhood passion. Another childhood passion was to learn how to fly. Again, it's something that it's when I was a kid, I always wanted, probably in another universe where I'm not a doctor, I wanted to be a pilot. Subhanallah, it's just, in the back of my mind, it wasn't really, it wasn't that pushing of idea that, oh, I need to do. No, it was just an idea in the back of the mind. But when COVID hit in when we start slowing down in 2020, suddenly I'm not, I'm a busy guy. Every day I work 14, 15 hours, and now I'm sitting at home. I probably, instead of doing 10 cases a week, and now I'm doing a couple of cases a week. Okay, what do I do with all this time? And subhanAllah, this idea ignited in my mind again. And so, I went and kind of learned quickly, what do I need to do to become a pilot? And 10 months later, I'm a pilot. Alhamdulillah Rabbil Alameen. So that was, I did that
And
in
you own
20.
your own jet, right? You own your own
Right. So
airplane.
in 2020, I got my private pilot license. So that, give you the ability to fly around the US. And then I looked into it. I thought, okay, probably it's a good investment to have my own little airplane. So I got a little airplane, just exactly similar to the one that's behind me, a five-seater. We hop into it, me and the family, and go around. I think it's fun. It helps you de-stress. Again, there's a lot of lessons that you learn from the journey of becoming a pilot. Again, going back to the goal-oriented, it keeps you focused on always have a systemic way of thinking. Don't you do need, there's always risk in life. You need to take risk, but always calculated risk. And I think this is one of the great things that I learned from journey to become a pilot. Yeah, and this is my advice to people: take risk in life, but always make sure that it's a calculated risk.
Right. Yeah. Definitely you are a goal-oriented individual. MashaAllah, starting from since you are in ninth grade, you spoke about how you saw the surgeon, you went to medical school, went to England, and now going to helping back people, giving back, what we call sending the elevator down by training, and also helping people back in Syria, and now also learning your hobbies. And just for the audience, Dr. Bakri Kaakeh is married, happily married, and has kids. So with all of this, mashallah, activities and work he's doing, he's also a great father and a husband and a great friend in the community. Dr.
Thank you.
Bakri, really, thank you so much for your time. This was one of the best interviews. I learned a lot about you. I know you individually, but now I know more about you. And I think your story is going to be a great inspiration for the generations to come, especially for the Syrian people who have a dream, especially for the students who are really desperate, who are coming from school like us, back home, but they said, "This is the dream. This is your target. You can do it. Hope, never give up. Focus on your goal and be humble." I think this is what I learned from you today.
Thank
Bakri,
you.
thank you so much for your time. And
Thank you.
for our viewers and audience, thank you for watching us for another episode. This episode will come to you in June, inshallah, and for Sam's Voices. Bakri, thank you again.
Thank you so much. Thank you, Shadi.